Good afternoon once again. Today is Wednesday, June the 10th, 2020, and this is the English language summary of the daily press briefing here at the CCSA. As mentioned earlier, we have the English language summary for you from now on every Monday, Wednesday, and Friday only, not on Tuesday, Thursdays, and not over the weekend. So for today, the spokesperson began with very important information that the CCSA is discussing the details about the fourth phase measures that will be finalized at the CCSA meeting this Friday. The CCSA meeting this Friday will be chaired by the director of the CCSA, which is the Prime Minister of Thailand, and they have been proposed with a draft document of the details of the measures for the fourth phase. The spokesperson also mentioned various information regarding the fourth phase measures being proposed. Here I will just outline and give a preview in general, but perhaps a minimum outline for now, because as mentioned, it will be finalized on Friday. And of course, we can foresee and perhaps foresee which businesses or measures will be having more restrictions and more easing of restrictions rather, because it is the last phase. It is the fourth phase around the middle of June. This will be the beginning of the fourth phase, and towards the end of June, we'll be ending the fourth phase, and there will be no restrictions left unless regarding those that are very necessary. So just a brief outline, just three clusters. The first is that the fourth phase will most likely ease the restrictions regarding schools and education facilities to the maximum. The second is to ease the restrictions concerning economic activities and livelihoods. These include various businesses that were previously closed during the current phase, the third phase. For example, the fourth phase, there will be the opening of for having meetings, meeting rooms, exhibits, events, and exercise activities. One important piece of information which I'm very sure that you are waiting for is that the fourth phase will most likely allow the selling of alcohol. Alcohol can be sold and consumed in restaurants and business establishments. However, alcohol cannot be sold and consumed in bars and pubs and beer houses and karaoke bars as examples. Only in restaurants they would be able to be sold and consumed at the beginning of the fourth phase. However, when alcohol is sold and consumed in restaurants, one prohibition for the fourth phase, which is being proposed, is that there cannot be any direct sales or marketing activities. As you know, in Thailand, there are direct sales agents, meaning that when you drink beer, for example, in a restaurant, there would be a salesperson approaching and trying to sell to have you consume or purchase more alcohol, more beer. So that will not be allowed because of the intensity of the interaction between the direct sales persons and the customers. So restrictions like these, minimum restrictions like these. So in the fourth phase, it will be finalized, the measures will be finalized on Friday. I'd like to just speak to a minimum first, just to be very accurate. So on Friday, we'll be coming out with more details of what exactly the fourth phase will entail. So moving to the general situation in Thailand, we have 4 new confirmed cases for you. Recorded for today. All of them are imported cases and are currently under state quarantine. All Thai nationals, 4 cases, 1 from repatriation from Madagascar, 1 male from Madagascar, 1 female from Pakistan, and 2 other females from India, all Thai citizens and who have been placed directly into the state quarantine system, making the accumulated number of cases in Thailand 3,125, and of this number, over 95% have recovered or been discharged already, and there are no additional deaths reported today. So these cases are all imported cases. It makes now 16 days now consecutively that we have not found domestic infected cases. So for the past 16 days, no domestic infections, only from imported cases, meaning persons returning from abroad through repatriation or special flights. But of course, this does not mean that we can be complacent already. As we ease the restrictions, we, of course, continue to ask for the general public's cooperation when you visit malls, temples, tourist sites, and beaches that are now open. It's still very important, of course, to keep in mind all of the important safety measures. So just in terms of numbers, I have one piece of information which is important, is that even though we have zero domestic infection for the past 16 days, and most of the cases in the past 2 weeks, over 2 weeks, are all imported cases, we would have to say that Thais returning from abroad are the main the main group of people who have made the imported cases in Thailand each day be counted. However, we have to look at the bigger picture, that the imported cases are, of course, mostly asymptomatic, and usually we cannot detect the cases before they arrived, most of the times, because they are asymptomatic. And the number of Thais coming back through these channels, imported cases, are not very high, actually. So just to give you some numbers, out of the over 3,000, as I mentioned, 3,125 confirmed cases for Thailand, out of this number, around over 3,000, only around 188 of this number were from imported cases, meaning that the others were, of course, infections from the local sources from the beginning a few months ago. As you know, the boxing stadium, the bars in Thong Lo in Bangkok. So out of the number of confirmed cases in Thailand, only around 0.6% of these are from abroad, compared to those who are having the infection. Now, compared to those who are returning from abroad, it is only around 0.007%, so very, very, very little. The number of people returning from abroad, meaning repatriated from abroad, to date around 26,000, and only a handful, 188, came back infected. So this actually is a reflection that for those coming from abroad, Thailand is able to detect and treat those who are returning from abroad and put them straight into the state quarantine system. So it's a challenge, but then I just give you these numbers for clarity, that the number is not that high. If some people say that the Thais returning from abroad are the group that are making the numbers increase, if you say from the last 2 weeks, yes, but then if you look at it, the general picture from the beginning, it's a very small percentage. So moving on to the issue of the compliance to the guidelines. Yesterday we have around 20,599 sites that have been inspected, with only a small number, 10 sites, found to be not fully in compliance, which is only less than 1%. And you have an English language slide for you on screen on this, different business clusters of the inspected sites, restaurants, salons, child care centers, and the like. And we again thank the various establishments that are fully in compliance with the guidelines, and we note the cooperation and the challenges that they face, and hope that they continue to join in helping to combat COVID. So after the spokesperson, we also had a speaker from the Ministry of Digital Economy and Society, Dr. Polawat Withoon Golashit, the Inspector General, who outlined, updated about the application Thai Chana, as you all are aware and should be using already when you enter the business establishments. He also informed us about a simulation test that was held for Thai Chana that it was a simulated situation that if there were hypothetically an infection, the information that was collected in the Thailand platform was hypothetically used to contact the different other customers who were in the same establishment during the same time and same venue as the person who was supposedly infected. So that simulation was held, and around over 500 persons who visited that establishment were contacted. So it's a very good simulation. The results were very good. We know now that, of course, when and if there is an infection, the Thailand platform will be able to contact many hundreds of people who visited the sites that were found to have infected persons or infected cases. So, as usual, I have some images for you from the activities of the embassies abroad. We have first from the Royal Thai Embassy in Beijing on screen for you. And also, it's about a repatriation flight that was facilitated, yes, from Beijing. And the second image is also from the Royal Thai Embassy in Washington, D.C. in the United States, where we have the embassy and staff able to assist Thai nationals in the surrounding area to take the flights back to Thailand. You see on screen there's a monk there as well. Yes. So I think we have around two images. That's all we have. Yes. Okay. So just in addition, one point that the spokesperson mentioned was also that all of this is a learning process for us, even here at the CCSA, and also a learning process for the media as well. The other day we had meetings with the media, and it was also observed that these days some newscasters on television wear only the face mask, only the face shield, but not the face mask. So what we demonstrated in the other days was that the face shield must be worn with the face mask. So I guess that's one improvement that they will be doing. The newscasters now will not, of course, hopefully they will take that into consideration and wear face masks along with face shields as well, and not only face shields when they're on television, or choose one, or choose wearing the face mask. That's very important. Or sit far from each other, practicing social distancing while performing their duties as newscasters. Yeah, just one anecdote there. Just one anecdote. So just in conclusion, of course, we're moving towards the fourth phase, as mentioned. Just remind that it's a joint effort. The government cannot do this alone. The CCSA cannot do this alone. If you've been following the news, the press briefings every day, of course, we seek for your cooperation every single day. We try to be the most inclusive as possible. Also, of course, the private sector and young people are very important. We're all in this together. So, just an image for you coming up on screen, a caricature. As you recall, the 5 main principles that all the general public and businesses should be following and not putting the guard down on these. Washing hands, and you see on screen now. I won't have to read it, because these are the new normal behavior, social distancing, personal hygiene, masks, and the like. So just to urge that we remain vigilant and continue to give, hope that all of us will give full support to all the measures and get accustomed by now, of course, to the new normal behavior that will help us to prevent any further spread of COVID. So in summary, this is what I've captured for you, recapped for you about the press briefing here at the CCSA. Of course, the airtime that we have for the English language version is not as long as for the general audience, which is in Thai. They have a longer airtime, so I tried to capture the salient points. But as the spokesperson mentioned, and I'll mention again also, that information can be found on the various websites that were mentioned: the Public Relations Department, the CCSA's website, the thaigov.go.th, the Facebook pages, Public Relations Department, and the like, which have English language pages and information in them. And of course, yes, the Department of Disease Control as well. As I mentioned, they have a very good English language page and daily situation analysis uploaded every day. So in the meanwhile, when we don't have the summary on Tuesdays, Thursdays, Saturdays and Sundays, you can avail of the information provided online. So thank you very much. This is all I have for you for today, and I'll see you again on Friday. Have a very pleasant afternoon, and สวัสดีครับ
ครับกราบขอบพระคุณ